Hey, it's Hassan here, and today I'll be talking about systemic lupus erythematosus, or simply the acronym SLE. So, what really is SLE? Before we get started, let me break down the acronym SLE for you. So, S stands for systemic, which means that it can affect any organ of the body, such as the brain, heart, kidney, skin, and pretty much any other organ that you can think of. L stands for lupus, and this word really comes from the Latin origin, which simply means wolf. This is mainly because the butterfly-shaped rash that you can see on the face of the girl on the bottom right picture, it has some sort of resemblance to that of the picture of the wolf on the left. So that's pretty much where this word originated from. E, however, simply stands for erythematosus, which means reddening of the skin. SLE is essentially a chronic inflammatory autoimmune disease in which our own immune cells just become hyperactive and go on attacking the healthy organs and tissues of the body. SLE is also known to be a great imitator of diseases, as it mimics other diseases like celiac disease, myasthenia gravis, rheumatoid arthritis, polymyositis, and Sjogren's syndrome, to name a few. The clinical manifestations are protean, which means the signs and symptoms are very variable, and none of the cases exactly look alike or exhibit the same symptoms. Ergo, differential diagnosis plays an imperative role in confirming SLE. Causes and risk factors. Like many other autoimmune diseases, scientists are still scrambling to find the cause of SLE, but it still remains elusive. However, genetic, environmental, and hormonal factors seem to work in tandem with each other and are known to play an important role in setting off this immune response. By now, you guys might be wondering, why am I only putting pictures of women on my slides who are affected with SLE? Well, it really stems from the fact that women are about 9 times more susceptible to SLE as opposed to men. And it is because it's speculated that the hormones in women are the cause of this higher incidence of this disease, such as the elevated levels of the hormone estrogen in women. Age is also a factor, as the symptoms are usually observed between the age of 14 to 45. Race is also an important factor. People from the African, Chinese, and Caribbean descent are at a higher risk as opposed to white people. Medications like anticonvulsants and antibiotics can also lead to a drug-induced lupus. UV rays from sunlight and susceptible genes like BLK and STAT4, they kind of work in conjunction, and in that way they can trigger and cause SLE because these UV rays tend to directly affect susceptible genes, leading to the apoptosis of cells and thus SLE. Immune system has a crucial role in causing SLE. SLE is known to elicit a type 3 hypersensitivity response, which is a term used to describe the accumulation of immune complexes, the antibody-antigen complexes that are not adequately cleared out by the immune cells. Interleukin 6, IL-17, IL-18, type 1 interferons, and tumor necrosing factor alpha, all of them are also responsible for this inflammatory response. Tingible body macrophages, many of you are familiar with. These macrophages, when working properly, they engulf the apoptotic B cells after somatic hypermutation. But in patients suffering from SLE, the TMG are significantly lower in count. So this leads to the undigested apoptotic nuclei presented to T cells, and this in turn activates the T cells. Increased necrosis or cell death of T lymphocytes is also observed, due to mitochondrial dysfunction. There's also reduced expression of CD44 in monocytes. CD44 is the surface protein which is involved in the uptake of these apoptotic molecules. So a reduced expression leads to accumulation of that apoptotic material. Usually, as we know, apoptotic lymphocytes are removed in the germinal center, but since the TMGs don't work effectively in patients suffering from SLE, there's a buildup of these apoptotic debris in the germinal centers. As you can see in this picture of a normal healthy cells, you can see how the scan is containing giant TMGs that are present, and these TMGs are also seen to be containing the ingested apoptotic cells. However, in the third and fourth picture, you can notice how there are fewer TMGs present, with a significantly higher number of apoptotic debris in the germinal centers. Also, sometimes autoreactive B cells also emerge after somatic hypermutation, which then migrate to the light zone of the germinal center, where they accumulate and elicit the inflammatory response. Moving on to the signs and symptoms. So according to the criteria set by the American College of Rheumatology, at least 4 or more of these 11 symptoms need to be present simultaneously in order to confirm SLE. These signs and symptoms include a malar rash, which is a butterfly rash, a discoid rash, which are the red patches on the skin, photosensitivity towards the UV rays, oral ulcers are observed in the mouth and nose, neurological disorders like seizures, joint pain and rheumatoid arthritis, Raynaud's phenomena, which is the cyanosis of hands and feet, because the blood moves away from these non-vital regions of the body towards the more vital organs such as the heart and the brain, which leads to the cyanosis of feet and as well as the hands. Anemia is also observed mostly in children. Heart problems such as endocarditis, pericarditis is also seen. Defects in the lungs such as pneumonitis, pulmonary embolism, and pulmonary hemorrhage, as well as peripheral neuropathy. So some of the tests that a rheumatologist is going to run to diagnose SLE is the ANA, or the anti-nuclear antibody test, as well as the complete blood count for anemia. A negative ANA test will rule out SLE. However, a positive test is not indicative of SLE, so more tests are required to confirm the diagnosis. Direct immunofluorescence test, it detects the IgG deposits in the epidermal layers of the skin, as you can see in the picture on the bottom. Urine tests like urinalysis is performed to assess the function of the kidneys, because most people affected with SLE have a damaged kidney called lupus nephritis. Tissue biopsies for skin and kidneys are also performed. Erythrocyte sedimentation rate test, which can indicate inflammation. Moving on to the prognosis. Well, there is really no cure for the SLE. However, 80 to 90% of people live a normal lifespan by following regular treatments and follow-up tests. On the other hand, if some people do have severe complications such as organ failures and cardiovascular diseases, which can greatly reduce the life expectancy. People also go through periods of illness called flare-ups and periods of remission, which can be controlled by leading a healthy lifestyle and by following a proper treatment. Treatment options are akin to treatments used for other autoimmune diseases like MS. These include corticosteroids such as prednisone, anti-malarial drugs like hydroxychloroquine, which we've been hearing a lot about since it is also being tested as a treatment for COVID-19. Immunosuppressants such as cyclophosphamide, methotrexate to control the inflammation, and ergo also suppressing the overreactive immune system. NSAIDs are also used, such as ibuprofen and naproxen. Monoclonal antibodies such as belimumab are used. These are human monoclonal antibodies which disrupt the activation of B lymphocytes by interfering with the BLYS protein, which is needed for B cell activity. This can in turn reduce the autoantibody levels to control the progression of the disease and thus ameliorating the symptoms of SLE. So I was able to glean an article published by Science Daily, which elucidates the study performed by Yale, in which they found a drug which can reverse the kidney damage caused by SLE. Since many of the people develop lupus nephritis, which affects the kidneys, a drug is found by scientists from Yale, which inhibits the hypoxia-inducible factor 1, which instructs T cells to damage kidney tissues. This drug has shown promising results in clinical studies by blocking HIF-1 function in humans, thus protecting the kidney from potential damage. The other article is about the famous singing star Selena Gomez, who suffered from SLE back in 2015, which caused a severe damage to her kidneys, but fortunately she was able to get a successful kidney transplant. So she goes on telling about how lupus had taken a mental toll on her by giving her anxiety and panic attacks, and how it is very important to live a healthy lifestyle afterwards, which can limit the flare-ups that are caused by SLE. Well, thanks for watching. If you guys still have any lingering questions, please leave them down in the discussion thread below, and I'll be happy to answer them all.